and stuff. Today we're talking all about the reproductive health exam. Today we'll answer questions such as what happens at a reproductive health exam, do your parents need to know, and what types of questions your healthcare provider or doctor are going to ask you. A reproductive health exam is a great time to talk to your doctor if you have questions about pregnancy, STDs, or your genitals. If something doesn't feel right, such as you have a lump or a bump in your testicle or breast, you have an odor or discharge from your vagina, you might think you might have an STD, think you might be pregnant, make sure to talk to your doctor. It's also a good time to talk to your doctor if you've had sex, whether protected or not. Also, your doctor will be happy to answer any types of questions you have. At your appointment, your doctor will check your height, your weight, your blood pressure, and possibly do a physical exam. This physical exam might cover looking at your eyes, your ears, your mouth, your throat, your arms, and your legs. Your doctor might ask you lots of questions, especially if you need to be tested for an STD, a pregnancy, or put you on birth control. Make sure to answer those questions your doctor or your healthcare provides you with open and honest answers. They may ask you questions about your period, if you have pain in your genitals, if you've had sex and what types of sex, if you have had unprotected sex and what types of unprotected sex, and if you've had sex with a man, woman, or both. During your appointment, your doctor is going to look at your genitals to make sure they look okay with no bumps or lumps and look healthy. They may also test you if you think you have an STD. This test may consist of urinating in a cup or drawing some blood. This test is usually pretty simple and painless. Again, also, if you are having sex, your doctor may also talk to you about being on birth control and put you on birth control if you are a female. The doctor will also check your immunization records. They're going to see if you have the Gardasil vaccine, which is also called the human papillomavirus or the HPV vaccine. If you do not have it, they'll ask you if you would like it, and it comes in a series of 2 vaccines. If you're 21 and have female reproductive parts, your doctor is going to start performing a pap test, a pelvic test, and a breast exam. It's important to start scheduling your reproductive health exams when you're starting to be at the age of 13 to 15 and every year from then. You should be getting tested for STDs every year. And if you're also having sex with multiple partners or unprotected sex, you need to be getting tested every time you have unprotected sex and every time you have multiple partners. Most doctors and nurses will not talk to your parents about what happens at your appointment. There's many states have laws that protect you from this, even if you're under the age of 18. If you're worried about your privacy, call your doctor's office or health center to talk to them about their privacy policies. If you're using your parents' or your guardian's health insurance to pay for your doctor's appointment, your parent or guardian might get a statement in the mail letting them know what services you got. If you're using your parents' health insurance or anyone else's health insurance, call the insurance company to find out about their privacy policies. That number for the health insurance company is normally listed on the back of the card. Or talk to your healthcare provider about the privacy policies used with your insurance. Now that's all the time we have for today. Make sure if you have any questions, always email us. Thanks and have a great day.